this morning for East Bay ADA's final webinar of 2021 about safe return to work. We have a stellar panel put together today as we all try to have a crystal ball and see around the corner into 2022, 2 years into the COVID-19 pandemic. Moderating today's session will be Tess Linyell, who's the Executive Director of the Alameda County Transportation Commission. She has more than 30 years of experience in planning, development, and implementation of major transportation projects across the region and is really a transportation rock star. We're thrilled to have her running the county's transportation long-term planning and infrastructure, and I'm going to turn it over to her to get things going this morning.
Thank you, Stephen, and good morning, everyone. It's such a pleasure to be here, and I'm so delighted to be with this esteemed panel who I'm going to introduce in just a moment. But I wanted to start off today with a couple of framing remarks regarding thinking about 2022 and returning safely to work. I wanted to share a little bit of background about the pandemic and see if there are maybe some lessons we can learn from past pandemics as we start to crystal ball into 2022. So as we all know, the COVID-19 pandemic was sudden and affected all areas of our life, the economy, the environment, our daily lives, commutes, transit, our healthcare systems, and fundamentally how we all are together as people. And I'm sure we can all distinctly remember Monday, March 16, 2020, when Governor Newsom declared a state of emergency in California and we went into lockdown. I'm sure that's a day we all remember what we were doing and where we were. We collectively walked through the COVID-19 door that day and it slammed behind us. Coming out of COVID-19 has proven to be much more of a roller coaster than walking through a door. And since the global coronavirus pandemic took hold in early 2020, everything's changed. But we seem to be finding our way to some semblance of a new normal, albeit I'd say in fits and starts. From the total shutdown last year to today, many businesses now operate partly or fully remotely. Roadway congestion, unfortunately, has returned to pre-pandemic levels. Transit saw immense drops in ridership, but is experiencing rebounding services and, good news, ridership. And we've come a long way in our healthcare systems, from the early days of overwhelmed emergency rooms to more smooth management of resources and vaccinations, including for youth, and most recently booster shots are easily accessible in the Bay Area. Just in October, we saw the job market rebound and we saw the unemployment rate fall to about 4.6%. And that was after we saw the staggering Great Resignation over the summer. We all are experiencing the global supply chain, which was affected by the pandemic, which is affecting the delivery of goods and the cost of goods. And we do see concerns linger that the economy is slowing. Again, this is certainly a roller coaster experience. The global response to the pandemic has been different around the world, and there are lessons we can learn from areas that have emerged through the pandemic fairly smoothly. And there are potentially lessons we can learn from past pandemics. And I'm actually going to harken back to one of the most severe and tragic pandemics in the 14th century, and that was the bubonic plague in Europe and Asia and Northern Africa, where the first quarantines were actually established. And what does quarantine mean? It was the first period of time during the bubonic plague where people stayed at home for 40 days, 40 giorni, or quarantine. That's where that word emerged. But however, after that dramatic and horrific plague, there we saw the outbirth of the Renaissance, particularly in Florence, which lost half of its population. Just last century, we saw the Spanish flu, which the first reported case, interestingly, was in March 4th of 1918, and the first case was reported in Kansas. That flu had 4 waves. The second wave was in fall of 1918, the third wave in winter and spring of 1919, and the fourth wave in 1920. The effect of that pandemic is very familiar to all of us. It struck suddenly, spread quickly, triggered quarantines, overwhelmed healthcare systems, battered retail, shut down transportation, and crippled our domestic industries. After that time, however, we saw the roaring 20s, and there was certainly a hyperdrive on technology and innovation. In this century, we've seen several cases of potential long-ranging or far-reaching pandemics. We saw the SARS H1N1 in 2009 in China, Taiwan, and Singapore, all of which who applied lessons they learned from having gone through that experience. And what we saw in terms of the lessons learned that they were able to apply is that they were opening their schools, opening their transit, and opening their workspaces back in March of 2020, when we were actually just shutting down. Ebola hit in Central and West Africa. It lasted for about 2 years, from 2014 to 2016. And those countries are seeing fewer outbreaks of COVID-19, potentially likely lessons learned from that experience. Here in the United States, we seem to be emerging out of the third wave, not unlike what happened in 1918 with the Spanish flu, which, as I said before, had 4 waves from 1918 to 1920. But as we've all been watching emerge on the news, we see the Omicron variant, which is triggering alarms in countries around the world, some moving back into shutdowns. As I said, emergence from COVID-19 is certainly a roller coaster, and we're not out of it yet. But at some time, we will move from pandemic to an endemic state with the virus, one where we will live with it. The question really then becomes, how do we inspire a sense of safety and trust in our systems for everyone? So today with this panel, what we'd like to explore is looking forward to 2022, and more people are planning on returning to work. What measures do we have in place to ensure a safer workplace, especially now we're dealing with this Omicron variant? What's the new normal of remote work and the future of commuting in the Bay Area? How are transit officials helping employees return to work safely? And what steps can workers take to keep themselves safe? So I want to turn it over to the panelists now, the people who you've been waiting to hear from. They're going to give us a window into what kind of things we can expect in 2022. And they'll offer their best crystal ball view on different scenarios for the future. So I'm going to introduce them all at the moment. And if you could just raise your hand. First off, I'd like to introduce Gwen Litvak, Senior Vice President of Public Policy for the Bay Area Council. James Paxson, General Manager, Hacienda. Bob Powers, General Manager at BART. And Dr. Jeffrey Silvers, Medical Director of Infectious Disease at Sutter Health. So I'm delighted to be here with you, and I'd like to now turn it over to Gwen to kick us off from the Bay Area Council.
Thank you, Tess, and thank you, Stephen, for having me. I'm going to do the scariest part of this presentation, which is try to share my screen. So hold on 1 second. All right, Tess, can you see the Bay Area Council survey? Wonderful. So today I'm going to actually share with you not my forecast for the future, but some results from a study that the Bay Area Council has been conducting since April 2021 of businesses of all sizes in industry throughout the region. And today I'll share with you our November results. This survey tracks a change in employer attitudes towards returning to the office and returning to transit. The November survey was conducted between November 10th and November 18th with about 189 responses from employers. So here we ask the question right now, what is your best estimate at the frequency your Bay Area workforce comes to the workplace each week? Employers are saying that about a quarter of the workforce is still at home. So you see that 0 days a week. With the remaining 75% coming in 1 day or more per week. Here we ask the question, once the pandemic is behind us, how many days per week do you expect your typical employee will come to the workplace? Not shockingly, what we see here is very consistent. Beginning in April and all the way through this last month, 3 days a week will be the new norm. Notably, in last month's results, you see that a slight increase in 5 days a week. This is the highest we've seen. Could be an uptick in respondents or in 5 days a week because respondents this month did skew to have more essential workers than in October, but still hovering here around the 20 to 23% over time. We then asked folks, how confident are you that your answer will be correct? Not shockingly, you see that people are getting more and more confident over time that people will be in the office about 3 days per week. like last month, employers think that the majority of employees will come in Tuesday, Wednesday, and Thursday. We have about 50% coming in on Monday. And not surprisingly, the fewest amount of folks want to be in the office on Fridays. You know, every single day has a higher average than our October results did here. And one of those possible explanations is that 5% more respondents this month indicated all of their employers are essential workers, as I mentioned. You also see a growing confidence in people's response to that question. And here we see that, again, about a quarter of the workforce is expected to be remote. We don't have historical data starting in April with this question because we just started asking it in October. So happy to update folks as we continue to ask this question as the survey moves on. Here we ask, post-pandemic, do you anticipate that most of your employees will come to the workplace for traditional hours? And there is a slightly more folks indicate flexible hours over the traditional commute hours. I would say that this slide indicates the biggest kind of recovery since April. Here we ask people, what is your best guess at when you'll start bringing non-essential employees back to the workplace? As you can see in October, this was the first time we saw over 50% of folks back in the office at least one day a week. But the jump from October to November from 52% to 65%, pretty significant there. From today, when do we think, or when do you think your office will return to a new normal? When will it be fully implemented? So not as big of a jump between October and November here, but this is still the 32% is still the highest percentage we've seen for a new normal. So just about a third of employers. Around 50% of employers anticipate operating under a new normal sometime in January, and right around 70% by March and 85% by mid next year. Now, we did ask these questions before Omicron, so again, happy to share next month's survey results as well. Here on slide 12, we ask, thinking about your employees returning to public transit, as of right now, how concerned are you about COVID safety on transit? The good news is this is the lowest percentage, 14%. That folks who are very concerned about their employees taking transit. We'd love to get that number, much lower, closer to 0, but trending in the right direction. This question is about whether or not folks are encouraging their employees to take transit. Again, no big changes from October to November. Most employers are neutral, but very few employers asking their employees to not take transit. And here on our last slide, we ask employers where they are receiving their information from with regards to transit. Not shockingly, the majority of employers just going to transit websites. So with that, Tess, I will turn it back to you, and I look forward to continuing our discussion.
Thank you, Gwen. This is really important data. And as you said, Omicron, we don't know what how that's going to affect that data. There's this emergence we're seeing where people are more comfortable coming back into the offices, into the working place, and we'll see what Omicron does to those responses in the future. Speaking of moving back into the workplaces, I'd like to turn now to you, James Paxson, General Manager of Hacienda. You just heard all this information from Gwen at the Bay Area Council. Tell us a little bit about what you're seeing in terms of people and employers returning to work, and how are your tenants approaching this?
Thanks, Tess. Pleasure being here with you all this morning. And I wanted to, first, before I get started, give a shout out particularly to the business organizations in the East Bay and who impact East Bay. Very grateful for the work that Bay Area Council has been doing and the information they've been collecting, the work they've been doing with employers. Likewise, East Bay EDA, East Bay Leadership Council, locally Innovation Tri-Valley, and our local chambers of commerce. They have been instrumental in terms of being able to help businesses navigate the last almost 2 years now. Interestingly enough, I would say the experience that we have had in Hacienda is very consistent with the information that's being reported. by Bay Area Council. I would say the one thing that's been a little bit different, the return to work has not been as rapid as some of the employers that were surveyed in the Bay Area Council report that you just heard. We're still seeing, plans shifting and changing. I think, one of the things that we have witnessed is a little bit of a change in thinking, especially over the last 6 to 8 months. I think, when the pandemic first hit, businesses were thinking, okay, let's get through this, and then we'll kind of go back to what we were doing pre-pandemic. And that thinking has certainly evolved over time. And I think certainly with the arrival of the Delta variant, people started to begin to realize that, the long-term prospects and the new normal was going to have to be both resilient and adaptive. And I would say that, one of the things that we certainly have watched happen with the businesses, and especially in the Tri-Valley and throughout the East Bay, is amazing and remarkable exhibitions of both resilience and adaptation. And I think, people are understanding that that's really part of the new normal. So as we start to look at what happens with the, arrival of these new variants and what we have to do in response, I think the plans have shifted a little bit. We had a lot of companies, and especially some of our larger corporations, we're looking at trying to resume more normal business activity before the end of this year. And with the arrival of the Delta variant, that obviously changed. We had plans in place for resumption of activity after the first of the year. And I actually think that those will start to move forward, because as people have shifted their mindset into this idea that really we're going to have to be sort of more permanently adaptive and resilient, they've started to make plans to prepare their workforces for employees to kind of follow this new model. What does that include? It really has involved a lot of changes in thinking about how office space and office environment has worked. It's involved thinking about how people get to work. And I would add here, our public transit partners are very, very important for this. We, BART purchased land from Hacienda back in the early 90s, and we've had a station as part of our development ever since. It has been an integral component to making our workforce have the ability to get to work from a variety of locations from around the Bay Area. So having a functioning transit system is hugely important to us. I would say the third leg of the stool really has to do with employers learning how to adapt to employees' new needs. And so as health considerations become more paramount, both having a healthy work environment and making sure that the workspace is arranged accordingly, giving thought to how people can function effectively within the workspace and be safe from a health standpoint, but also understanding that employees have health situations at home that they have to deal with, and making sure that they can travel from home to work safely are really going to be important too. Employers are going to have hopefully some role to help play to kind of make sure that they will have the ability to have employees that can function well within the workspace. And I think, obviously this is going to be different to varying degrees depending upon the size and the industry and so forth. The hybrid work model, I think, is here to stay. Obviously, this is going to vary a little bit by industry, because some industries are going to require that people actually arrive at the workplace. There are some things that you just cannot do remotely. And so those, I think, are going to have to be thought about in a slightly different way. But I think general office use, everything that we're hearing is that the new hybrid model is absolutely going to be a part of work going forward. And I would say, again, from what we're hearing from our employers, it's very consistent with the information that you see happening or see being reported in the Bay Area Council survey. So I think, again, prospects are good for getting some return to work in the coming years. And we're hopeful that as this adaptation and resilience planning continues, we'll start to see more people back in person in the workplace soon. Thank you.
James, thank you so much. And, you mentioned a couple of times adaptation and resilience, and that's certainly, those are key words for all of us in all of our work. And I would say, BART is such a core piece to what the Bay Area is. We wouldn't be the Bay Area without BART. And so Bob Powers, General Manager at BART, I'd like to turn it over to you now to share with us a little bit about how transit operators are helping people return to commute safely. You've done so much. We'd love to hear from you.
Thanks, Gwen. Good morning. Good morning to everybody on the call. So first, let me just start by thanking the East Bay EDA. Many of you know that we just kicked off a study with East Bay EDA as one of our partners on looking at on the A line, which is basically from Lake Merritt down to Warm Springs Station along the BART line. We call it the A line, but it's a study on looking at ways to increase jobs, the number of jobs within easy access to those along the A line there. And East Bay EDA has been our partner, and this study has just kicked off. So first, let me thank the East Bay EDA for that. So a couple of points I would make on the topics that were already discussed here. So one, on Gwen's data set there, from BART's perspective, it's encouraging that folks are starting to come back into public transit. And I think that when that shift it's happening, and maybe slower than what had been previously reported. And but when that happens, or as that's happening, BART, public transit as a broader topic, needs to be complementary to that. Tess, in that, if it's 3 days a week that folks are going to be back in the office Tuesday, Wednesday, Thursday, or Wednesday, Thursday, Friday, whatever that data set looks like, that we collectively want folks to be taking public transit. I got this morning in the papers about traffic being at pre-pandemic levels, all right? And so for us to be complementary to that, public transit needs to provide clean, safe, reliable, obviously, right? And we think that we're doing that as a whole public transit in the Bay Area, but we're improving on the connectivity. So if you're taking AC transit to BART and you're connecting at Fruitvale Station, you're connecting at Coliseum, that those connections are there, that they're timely. And so we're improving on that. And the other thing that's really important that maybe I don't want to miss is putting the service back out there and making sure the service is there. So when folks are going to be coming back to the office, that public transit is available. What we're seeing a little bit, and Gwen had reported on it, is this a shift in peak hour. So folks might, it appears to be anyway, that folks, maybe you'll take the first few hours and take a couple of Zoom meetings or team meetings from 8 to 10, and then jump on the system, and go into work. And so, this off-peak shift, from BART's perspective, I have to be there at 15-minute headways. So people, when they're coming into the system, they can get to the office and they can get there safely and they can get their reliability and on time. So the other piece, Gwen and Tess, that I would say, it gets to a little bit what Jim was saying about public transit and the safety aspect of it. So at BART and many other transit agencies in the Bay Area, I'll give you one example on safety and feeling safe in public transit from, COVID, that BART just recently replaced every one of our air filters in every car in the system. So Tess, if you're jumping on the system and you're going to a meeting downtown, you're going out to Walnut Creek for a meeting or something, every air filter in our cars have been replaced from it's a technical term, but a MERV 7 filter to a MERV 14 filter, which traps the COVID particles. They're transmitted by air and respiratory breathing, but a MERV 14 will capture all of that and prevent it from being transferred. And that air gets recycled every 70 seconds. So what is that? I mean, for somebody who doesn't know, so when you jump on at West Oakland and you're going over to San Francisco, that short ride, the air in the car that you're in is recycled 5 times. By the time when you get on at West Oakland and you get off at Embarcadero, the air that's been in that car has been recycled through that MERV 14 filter 5 times. So from a safety perspective, and I'll speak for all public transit on this, there is nothing more important than the passenger safety in the system. And that includes from COVID-19. And I think we're doing a good job there.
Thanks, Bob. It's so appreciative. So we're so appreciative to hear all of the things that BART has been doing for the cleanliness, for the safety. I mean, you've been doing an amazing job at not only doing the work, but sharing the work. And already you have a fan base who are in the chat talking about how they love riding BART and don't want to sit in traffic. So
they can buy one of our new sweaters, right? Our new Christmas sweaters, yes. Holiday sweater, yes.
Right. Well, speaking of health and safety, I'd like to turn to Dr. Jeffrey Silvers now and get an opportunity to hear from you from a health perspective. You know, we have reopening of work. We also have reopening of schools, and both of these help people return to work, but they also open up additional opportunities for the virus to be transmitted. Can you share with us a little bit about, you know, your thoughts on health implications moving forward and safety needs that people should follow?
Yeah, thank you for inviting me. And this is really an important topic because we have to, you talk about a hybrid model for people returning to work. We have to have change about how we think about kids going to school and what we're going to do. So let's go pre-COVID. And the mom or dad is there and the child comes and says, oh, I don't feel well, I'm all stuffy. And mom has to go to work and dad has to go to work. And they say, oh, okay, honey, I get it. So let me give you a little bit of Tylenol and you go to school and you'll feel better by the time you get home. And of course, the child gets worse in school and happily transmits the common cold at that point. Coronavirus used to be a common cold virus. To multiple other kids who then take it home to their parents and their families. And then ultimately, some of those people can't work, but many of those other parents will continue to work and they will have the respiratory infection, which they will then spread to other workers. And the beat goes on. COVID has changed that. Flu should have changed that, but it never did. But COVID definitely has changed that. And so people have to understand you're not going to be able to send your child to school necessarily if they're not feeling well. It's going to be a difficult balance because COVID presents in so many different ways. It's going to be a difficult balance between knowing whether they might have something that's contagious or whether they're just kind of playing their parent pretty well and saying, I got you, Dad. I know what your number is, and I'm going to say, this bothers me, and you're not going to make me go to school today, and I'm going to be happy. So that's going to be a little bit of a balance, and you have to have a workforce that is hybrid in many locations, whereby I could call in, or Tess could call in, or James, or John, or Mary, whoever, and could say, my child's sick today. I need to work from home. Now, that isn't going to work for retail spaces, obviously, pretty well. And it won't work for restaurant industries very well. But there are other industries and businesses that it will work, and that has to be incorporated in there. So that is a paradigm shift from how we treated kids going to school with illnesses. And then, we've also noticed because of COVID that people haven't had common colds and respiratory infections in the last year and a half. It's been kind of nice, hasn't it? And so people have learned about things called hand washing, hand hygiene. Wow, that's pretty novel, right? Covering a cough, not sneezing into everybody, maybe even not blowing out candles on the birthday cake, and social distancing and masking. And that has to become part of our norm going forward, and that will happen in schools as well as everywhere else. And in the end, we'll be much better for that. And so that's kind of where I see us going with schools. We've taken clearly some major steps forward. We have to continue with those steps forward for the health and the welfare of our society.
Thank you, Dr. Silvers. Well, I appreciate hearing from all these very different perspectives on your crystal ball and the needs for going back in 2022. We do have some questions that we'd like to hear from each of you. And I'd also like to share with the audience to feel free to submit questions through the chat. And we would like to hear from you and have our panelists answer some questions that are on your mind this morning. So I'm going to start off, Dr. Silvers, with you, since you were the last speaker, and you talked about very practical approaches on masking, not sneezing into everybody, not blowing not blowing out the candles on the cake that everybody is going to eat. Those are sort of physical and practical safety measures we can all take. We also know that COVID has had lots of implications for mental health. And, when we're thinking about employees going back, there's going to be a big change for people if they do come back, if they've been remote for almost 2 years and they're coming back in 2022. Can you touch a little bit on just return to work safety and the concept of mental health and wellness for employees?
Thank you, Tess, and I'd like to do that. Before I do that, though, I forgot to mention the exceptionally important part about kids returning to school and the parents. It's called vaccination. And I don't know how I let that get by me because I'm a strong believer in it, but it's flu vaccines for everyone 6 months and older. There's COVID vaccines for everybody 5 years and older. And that is like critical to people going to school in a healthy workforce. Okay, in terms of mental health, so much has happened for people that they never anticipated. I'm an epidemiologist, infectious specialist, and I've known about flu, and I've been involved with many areas of flu and research and presentations, and I know how it presents, but people kind of never really got the flu in terms of what it meant. COVID's really kind of changed the perception of respiratory infections and what the potential implications are. Life has been changed like it was in 1918, as Tess was talking about. People are isolated. People get depressed. People don't eat. People eat too much. People don't exercise. There are people who exercise all the time. People don't know what to do. Coping mechanisms are all challenged. So in the workforce, as we come back, I think it's really important that we recognize that. And how are people going to express it? They may express it by crying. They may express it by anger. They may express it by not talking to you. They may express it by potentially the worst of all is violence, right? And so we need to recognize that people are having problems coping. And as leaders, employers, and as employees, we need to show compassion for other people. And we need to offer that we'll support them. And first of all, you need compassion, and you need to compliment them on small things, even things that you would take for granted that they should do, and they did it. Compliment them, okay? As a leader, your glass needs to be half full. None of this half empty stuff. Actually, I think it should be 3/4 full. We are going to get through this, and we can get through this. And if you are when you offer support for people, can't be empty promises. So if you say that, you care about someone and say, let me know if there's anything I can do, that's nice. But if you actually recognize something that you can do that's small, that will help that person, make them feel more comfortable, do that. And that is really important, that we need to do that for everybody all the time.
Thank you, Dr. Silvers. Certainly an empathetic viewpoint to recognizing that people are going on this roller coaster ride, not just ourselves, but everybody else is on the same roller coaster ride I was talking about. Speaking about a roller coaster ride, Gwen, you talked about different viewpoints of businesses returning to work. Bob, you operate BART, which means you have to respond to those people coming back to work. And you also have operators who are essential workers who are in the trains and the operating centers, doing all the cleaning, doing all the maintenance, day in and day out. They don't have the ability to do remote working. And then James, you're dealing with businesses who are rethinking, that adaptation, et cetera. So can you all maybe touch upon some ideas about what it means for getting employees back to the office? Is that even the right question? Do we need to get employees back to the office? And what are your thoughts about, attendance and some of the empathy that Dr. Silvers was talking about? Anybody want to start off? Bob, how about you start off?
Yeah, I'm happy to start off. So I think Gwen, or no, sorry, Gwen, Tess, sorry. The importance that BART plays, the role that BART plays in the Bay Area, has been well documented, right? And, we've been out there providing transit service. We are essential to keeping the Bay Area moving, whether it's from a transportation and economic engine, whatever lens you want to look at it from. And so you're right, we have train operators, station agents that have been out there every day. We track inspectors every day. But it's also important that those men and women, our frontline men and women, have their support staffs available to them to be so that they can do their job. So, BART views itself as a family. And so it's very important from our perspective that our team is, all together moving forward on this. So we will have a, return to the office policy, pulled together. We already have one pulled together that I kind of put on hold with this Delta variant. But it's very important, because you're right. Tess, there are men and women out there, whether it's in the health profession, transit, that don't have an opportunity. And one of the worst things we can do is if those people are out there and then, their front line behind them are not available for whatever reason, and we've let them down. And so, we're going to be bringing people back in at the appropriate time.
Great, thanks, Bob. James, I see you're unmuted right now. How about I go with you, and then to you, Gwen.
I think you're raising a very important question, and this is part of the evolution of the thinking about workplace that's been happening. It's been obviously a little bit of a forced march over the last 2 years. I think we have to segment the discussion a little bit amongst different types of businesses. And as was pointed out earlier, there are some things that are absolutely location dependent. You have to be at a physical facility. Retail and restaurants were mentioned. But things like logistics, light and heavy manufacturing, those things require people to be at a specific location doing a specific job. And so those workplaces are going to have different challenges to be able to make sure that they're being able to conduct work safely, and that they create the new level of trust that's going to be required with their employees to be able to have them come to the workplace every day. I think there are also a lot of businesses, and we certainly, have talked with a number of them, and we have several of them in Hacienda, where people believe and feel very strongly that in order to advance their own particular business model, in-person collaboration is a really, really key component of that. So I don't think that goes away. I don't think anybody would dispute the fact that, technology has actually served us pretty well to the extent that it's been available over the last 24 months to different people to take advantage of. And there's been a lot of things that have been facilitated by technology that have really helped to make sure that everything can continue to function even in the midst of a pandemic. A lot of people you hear anecdotally will say, hey, I've been able to participate in meetings or been able to do things with other people that I haven't been able to do because we're doing it virtually and we're doing it on a platform that doesn't require me to get from one end of the Bay Area to another in order to be able to participate. But I would also say that there's a number of companies that we've talked with that really feel that in-person collaboration, having people work together in and with one another, is a really critical component to be able to have the type of interaction that's needed to fit their particular business model. These companies are also going to have to be confronted with making sure that they're addressing the types of things we've been discussing, this morning about how to have safe workspaces, how to have those collaborative environments, but also how to be able to make sure that they're addressing employees' needs. I think Dr. Silvers raises some very, very important points is that, one of the things that we see severely impacting workforce participation right now are things like how do you handle childcare? How do you handle education? Those things really do have an impact on employees' ability to participate in the workforce. And because of that, employers are going to have to start to think a little bit differently about how to make sure that they're addressing those types of things as well. They're not going to be able to solve them for employees, but they are going to need to be thinking about that in their business models, so that if in-person participation at work is important, being able to sort of think about how they can work with their employees to make sure that those things can happen.
Yeah, and I think James hit on the high points. I'll just add a few things. I think now is an opportunity to rethink the balance between in-person and remote work. So a few companies are setting specific hours during the day where in-person meetings can happen, like between 10 and 2. So there aren't expectations that folks are in the office at 4 p.m. or 8 a.m. It is specifically to address the childcare issues that we've raised, traffic issues, the workflow issues. The other thing I would say is to be slow and to be flexible. And mental health issues came up earlier on this call. I also think, I hate to say silver lining because the pandemic has led to so much suffering amongst so many, but at least within the Bay Area Council, we talk about having just a bit of time back. People mention spending more time with their kids or making lunch. These are not extravagant things. These are things that are core to our humanity, being able to take a walk, see our loved ones. And so I think it will be really hard to reverse kind of these things that are core to us now that folks have experience in them. And so we're just really cautioning and hoping that this can be a hybrid between in-person and remote that facilitates both the strengths of both of those and minimizes the weaknesses of both of those approaches.
Flexibility and adaptation, these are key words here, and I think those are going to be the baseline of what we need to follow moving into 2022. Dr. Silvers, there is a question in the chat specifically for you. The question is, how should we think about the balance between keeping a clean, safe environment and behaviors to avoid illness, as opposed to the needs of our biomes for diverse bacteria and possible advantages of exposure to dirt? So how do we not keep it so sanitized that we don't have the ability to fight against germs out there?
Well, yeah, thank you. And actually, it's a wonderful question. But I kind of follow the beliefs of Voltaire that perfect is the enemy of good. We are not able to sanitize the environment everywhere such that the bacteria will not get, we will not be exposed to bacteria. So I don't actually think that's it's even really realistically an issue, because we're humans and we're not perfect. So we have to do the best that we can, and we have to be reasonable about it. Okay, so teaching people to socially distance when possible, but obviously there's a lot of times we don't want to socially distance, and I'm totally supportive of that. Wearing masks when appropriate, hand hygiene, covering your cough. These are reasonable expectations. Cleaning surfaces. Trust me, your surfaces aren't perfect. Okay, they are not perfect. Just come to my house and I'll show you a house where things aren't perfect, right? And that's okay. We just have to do better than we used to do, and we have to learn to adjust.
Again, adjusting and adapting. Speaking of adjusting and adapting, there's been a lot of discussion about the changing market for office space, the changing all these schedules, where people are going to work. Are they going to work from home? Are they, how are they commuting? Bob, you've already been adjusting to the different hours of peak periods.
Right.
What are we seeing in the demand for office space, and what are you seeing in terms of like everything? We went from this very collaborative open space, everybody sit at the table, strangers, it doesn't matter. That was in restaurants, that was in office space design. It was all about bringing people together so that they could exchange those ideas. And now we have coronavirus and all the mutations and variants. And now people are thinking very differently. We need to distance. We need to have space separate for people. So I'm wondering, James, and maybe Gwen, you might address this, and Bob or Dr. Silvers, certainly feel free to chime in, but what are you seeing in terms of the changing demand in office space and even the structure of office space? James, you're nodding. Why don't I start with you?
Sure. Well, I think we don't know yet entirely how all of this works out. And as I was alluding earlier, again, I think some of this is very industry specific. There are some places that simply require facilities. Nationally, right now, the one piece of sort of good news that's emerging in the real estate market is that the sublease activity seems to be slowing, and that we're starting to see an absorption of sublease activity that's emerged. We've been in a really tough period for office space over the last 24 months. I don't think in East Bay we're completely out of the woods yet, but there seems to be some recovery happening. There's some activity, you'll see throughout the Bay Area. There's been some really good announcements, and I think generally in some cases the Bay Area has actually fared better than other places in the United States. Even absent the pandemic, there's still economic activity happening. I would say that what we have witnessed in Hacienda very much is not so much a complete cessation of the normal business cycle, but certainly a disruption to it. So you've seen, for instance, as leases and occupancy kind of reaches its normal termination, that's been expected. But what we haven't seen has been as rapid re-tenancy, and some of the new business activity has certainly been slowed by the pandemic, and decisions about relocation and expansion have certainly been slowed. But I would say there are very much sectors that are alive and well. We look at light manufacturing, especially biotechnology, seem to be doing very, very well. And we're already seeing some additional activity in those areas, and we expect to see more. I think for sort of normal office, it's a very, very uncertain future about sort of what's happening with that. Again, I think there are, whether you have an actual requirement to be in a physical location or not, or whether it's simply desirable because of your business model, there will always be a demand for office. I think it's going to be changing though. And again, the hybridization of work that we've been talking about this morning, I think changes that a little bit, but to what extent and how much, I think still remains to be seen. I think you make a very good point about what's been happening with sort of the design of office spaces, and yes, that will probably change too. But then again, with the deployment of vaccines, and with the change in the foothold that coronavirus and other diseases are able to take, that may change again too. I think we still don't know kind of where we're going to be and where we end up on that. These things, follow their own normal cycles anyway. So we'll have to kind of watch and see what happens over the probably next year. Will tell a lot more about where we're going to see the future of, kind of office design.
Speaking of office design, Gwen, in the Bay Area Council, are you guys getting input on what people are thinking of doing in terms of restructuring their office spaces, or is it sort of a holding pattern right now to see how people are coming back?
Yeah, we're seeing more of a holding pattern. I would say similar trend in the sublease market in San Francisco. Unfortunately, I'm not as familiar with region-wide, particularly because I live in San Francisco, so I walk around and just see the changes. But I think we're seeing a bit of a holding pattern. Our data did show that people will be in the office Tuesday, Wednesday, Thursday. So it's not as if people are getting rid of their spaces completely. And certainly we see that expansion, like James said, certain sectors. So I think still a bit in a wait and hold pattern, knowing that this hybrid is here to stay, but not completely moving to a new way of using office space quite yet.
And what about you, Bob? Have you done any restructuring of your offices to address social distancing and things of that sort, or are you just spacing people out separately?
Yeah. Spacing people out right now, Tess. The other thing, I would just touch on, and new technologies, and I mentioned the filter systems and the BART cars, but I would suspect that many buildings are looking at improving their air filtration systems, and moving to industry best practices if they haven't, on how often the air is changed out and the size of their filters that they have in there, and how small the grid system is. as you know, very similar to what we did on the BART vehicle. So I suspect that's happening throughout the Bay Area as well.
Yeah. Okay. Dr. Silvers, I'm going to transition over to you for a different kind of question. Before last week, we, here in California, I think we have, 74% or so people vaccinated.
Okay.
And we were all, looking at 2022 as this time for reemergence into the workplace, into schools, life, et cetera. And we started talking about this pandemic being characterized as something that is now endemic, something we live with, the COVID-19. Now we have Omicron that emerged mostly in the news last week and this week. Tell us a little bit about your thoughts of moving from pandemic to an endemic state with COVID.
Yeah, so pandemic, of course, means that the infection is worldwide, and it is going to go through periods where places where it is and not there, and it will be fine. It'll kind of come and attack. That's what we've dealt with COVID initially. Endemic is where it's always around, and it has some little waves where you have some outbreaks and stuff, and people are always going to be exposed and always going to get it, but it's not as transmissible as a whole. And of course, that would depend on us having vaccinated people and practicing appropriate things with hand hygiene and probably a lot of masking indoors and things like that. About 3 weeks ago, I started presenting, at Sutter Health, I do a lot of presentations for our organization on COVID because I'm the physician lead for the system. And I started talking about, we're kind of in a little bit of a bubble here in the Bay Area, even though it looks like we're going endemic. But if you look at, and even California, it's a little bit of a bubble, but you look at the country and you look at the world, there are multiple areas in the world that are having major upticks unrelated to Omicron, and Germany and Netherlands and some countries in, actually there's countries in the Middle East and there's countries in Asia, and we have to recognize that the pandemic, that part is still ongoing. So Omicron kind of opened up, and I wasn't quite ready for this major kind of organism strain to show up. It's not necessarily going to be, Delta has been, like, I've always talked about being the big kahuna. It really is the one that looks like it's displaced everything else. But Omicron looks like it's kind of getting its foot in the door, and we'll just see where it goes. So ultimately, I anticipate we're going to be endemic. I just don't know when that's going to be now. I think it has to has to reach the ideal strain with the mutations. The ideal strain is one that propagates very effectively, because that's what the virus is designed to do: reproduce, infect other people. The ideal strain doesn't kill people. The virus doesn't gain anything by killing the host. The ideal strain is to make them sick enough that they propagate it more effectively, but not make them sicker than that. And so, we can hope for that to actually happen, and then that would be kind of the endemic stage. And then who knows where we'll be in terms of how effective it will propagate when we have people who are vaccinated. Natural immunity doesn't last very long, so we really are going to depend on vaccinations.
Right. At the outset in my opening remarks, I talked about different pandemics. I talked about the bubonic plague. It lasted about 5 years for the worst part of it in Europe and Asia in the 14th century. The Spanish flu had 4 waves, lasted about 2 years. We're seeing just these periods of these infections 2 to 5 years. I think for our looking forward in 2022, I think we just have to remember that we're going to have to be flexible and adaptable as this emerges. And we don't know how, it's not like it's going to be a 2 year and then it stops. we'll have to see the implications of this.
Yeah,
So
so just one point related to that. The bubonic plague never mutated. The swine flu didn't really mutate in the 60s. The great influenza of 1918, almost no mutations. This organism mutates. It doesn't self-check. So it creates lots of mutations, and it survives by Darwin theories, survival of the fittest. If the mutations are such that the organism can propagate better, that strain survives. If it can't propagate better, it's not as fit, then that strain doesn't survive. And with so much disease around, that's why we're seeing so much change in variants. But when you go historically to other pandemics, the organisms didn't mutate. So it's a little different here. And this is why, vaccination is really could be such a key piece of this. If the natural immune system lasted longer, which it doesn't, it would have been extremely helpful. But the coronavirus, which this is derived from, typically escape the immune system as a common cold. You get the same strain every 6 months to a year. It's just that never made us so sick that it mattered, right? So it's very different. We'll see. My crystal ball batteries are out. I'm expecting a new model in another month.
well, I think that brings us to about almost the end of this panel session. And I did want to do a rapid round really quickly and just name your top 3 things. You don't need to put in any sentences or phrases, but as we round out this conversation, and so appreciative to all of the panel members, tell us what are your top 3 things we can do in this particular moment in history to support a new normal as we move forward. Dr. Silvers, you're on the screen. I'm going to start with you.
Okay, number 1, keep your glass half full. Number 2, get vaccinated. And number 3 is if you have a respiratory illness or your kids have a respiratory illness, you're going to have to pay the price and keep them home and not spread it around to everybody else.
Okay, good advice. Thank you, Dr. Silvers. Gwen, I'm going to go to you. What are your top 3?
Yeah, I think bake in those silver linings we talked about before, incorporate them in your new ways of working, flexibility and openness. We talked about adaptation. And then one thing I didn't touch on, but I think is really important, is more flexibility in our land use changes and processes. We saw the popular adaptation and adoption of safe streets. So being able to really flex our uses more easily region-wide.
Thank you, Gwen. And Bob, you're the next on my screen. Tell us from your perspective, your top 3 things for this moment in history.
So we have to be flexible. Public transit has to be there. We have to be flexible. 2, we have to be connected. And, the public agencies in the Bay Area, whether they're transit or health professions, we all got to be connected and sharing information. And we have to focus on safety.
Safety, flexibility, absolutely, and connected. James, can you round us out with your top 3 things?
Well, the problem with going last is that all the good points are made before you. So I would echo a couple that were made. I do think, obviously, flexibility and adaptability are important. I think what Gwen indicated, particularly with regard to flexibility in land use and rethinking how we use land and also how we use structures. The very nature of work itself is we're going to have to allow that to evolve. The other point that I would make is that I think, especially from a public health standpoint, we really do need to make sure that the recovery is equitable for everyone. It's important that we're focusing on making sure that the public health considerations that we're all confronted with right now are reaching all segments of society so that everybody can return to the workforce, and then we can bring back the productivity and the workforce participation that we need to have a thriving East Bay economy.
Thank you, James. I think all good advice from all of our great speakers here today. Want to thank you, Gwen, Litvak, Bay Area Council, James Paxson, Hacienda, Bob Powers, BART, and Dr. Silvers with Sutter Health. And a big shout out and thank you to East Bay EDA for bringing us together and having these kinds of important conversations. So thank you for joining us this morning. And Stephen and East Bay EDA, we appreciate the time and the opportunity for all of you joining us this morning. Thank you.
Thank you all. Have a safe and happy holiday.